And we're back. So once I go around the circumference, and again, make sure everything is nice and flat underneath there, you're going to go around the top, and you're going to get your frontals. And again, you really want to make sure everything is flat. You know, this might take you a little while at first, but when you get used to it, you can do it like that. So you really want to go around, and then I always keep it under the ear, and then I will bring it back here as far as I can. So you're going to cover your reference leads, and once again around the forehead, and then back again. You want to cover your O's completely, and then I try to go up, covering, you know, your leads up here and back until you run out, and then I'm going to give it just a little bit of tape. And then you want to put just a little bit of tape on the outside, just to take that first layer down. And again, you're really just covering electrodes with that first layer. So tape here, tape right back here. We're going to do the same thing on the other side. We're going to tape over here, and we're going to tape behind the ear. And patients really don't mind this. So then with your second roll, you're going to lift this up, and you're going to start from here. Tape it down, and you're going to make sure you cover your CZ and your PZ with the gauze. The whole point of this is to really separate the amplifier from the electrodes. And then again, I go down and around, and now I'm going to start covering this wire back here so it's not sticking out so much. And then maybe I'll come across here and cover that, and I'm going to make a little pocket so that I can stick my EKG electrodes in it. But you know, go over this wire, under this wire, make sure it's really secured. Again, we're going to give it some tape. And now I'm going to take these, I'm going to put them in here, because like I said, I've created a little pocket for that. And now what I do with the forehead, just to try to make sure we don't have a lot of pressure, I lift it up. You get a few layers here. You're going to lift it up, and you can see the wires. So you're going to lift it up so that this white piece, this hard plastic piece, is really exposed. I don't know how well you can see that, but see that white piece there? You really want to have, you know, less gauze right there. So now, take a little bit of tape right there, a little bit of tape right there, and now we're going to go for one more. So again, I'm going to come up here, and now is really where I'm going to cover the rest of this. And I don't go over the forehead again. Now I'm going to stay right up here over FP1 and FP2. And I don't use a chin strap because I feel when the patients move it up and move it down, it just loosens everything under here, and I feel that really loosens it. So now, you want to get a back shot of this thing? Mm-hmm. So now that was my third piece. So I'm going to tape it a little bit back here. So now we have this wire down here, okay? We have this. Everything is out of the way, and I put my EKG pads on in back to keep them out of the way of the patient. So now again, we're going to put a little on the side. And what I usually do is I start from, say, up here, and I kind of pull down. So that's really secure. Okay, and again, and you can do this for every layer. You can do this for the first layer, second layer, and third layer. You don't have to do it for everyone, but I recommend doing it for at least 2 of the layers. So now, we'll get more tape. We use a lot of tape, but it's worth it. Do this side first. And I'm going to go over those pieces of tape. One more more time over. You really want to try to cover all these pieces of tape here. Over the ear. One more. And then usually at least one up here. And I just make sure those are really exposed. And I also tell the patients that if they're feeling any discomfort or if they still feel pressure, they can always just lift this up and the whole thing will be exposed. Put it back down so it's really covered. And just make sure it's all, you know, sticking nice to the head. And if you have somebody with really, really oily skin, you can use a little bit of, you know, help me out, Jay. New Prep, thank you. You can use a little bit of New Prep, give it a good scrub, and then, or a light scrub, and wipe it, and the tape will stick just fine. And that's it. Want to get a view all the way around? How does it feel, Jay?
Feels secure.
Does it?
Yeah.
Does it feel too tight?
Wow, that's really on there. Yeah.
And if you wanted to, you could slab a piece of tape on there too. Okay. Ta-da, thank you.
Thank you.